Hi, everybody, and welcome. We have a Framing for Health Equity presentations from the FrameWorks Institute. We have April Callan, the Strategy and Outreach Associate, who has been our strongest support in framing our messaging. So thanks so much, April, and go ahead.
Excellent. Can you hear me okay?
Yes,
Sorry,
perfect.
yes. Awesome. I found my headphones. Hi, everyone. Welcome to today's webinar, Framing for Health Equity, Cultural Models that Shape Public Thinking. This is part one of a two-part webinar series on framing for health equity. Again, my name is April, and I'm the Strategy and Outreach Associate at the FrameWorks Institute, but I'm also a member of the network's Communications Working Group, as well as the Messaging Network Response Team Group. And so you probably heard the recording, but we will be recording this and it will later be uploaded to Socius. And so because we have some new folks and then this webinar will be used as a resource, I wanted to give a little context about FrameWorks and the work that we've done with the DinaQuest Foundation and the network before getting into some of the cultural models work. And then from there, I will talk a little bit about cultural models that are related to health equity. So for those who don't know, the FrameWorks Institute is a communications think tank based in Washington, D.C., where we differ from other communications firms is that we rely heavily upon various social science practices to understand how the public thinks about social issues and then develop new communication strategies to help advance social causes as well as social justice. So before we get started, it's always important to note exactly what we mean by a frame. So a frame is a set of choices that we make based on the information that we present that can be decided by what you choose to emphasize, how you explain it, and what you choose to leave unsaid. All of those are framing choices that we make all the time whenever we are talking to someone new or developing new communications materials. And so what we've found that when a frame works, it can move thinking in multiple ways. One, there is the knowledge that you're shifting for members of the public. You're also moving them to shift their attitudes about various issues, meaning you're shifting their perspective about what to do about that issue that you've raised for them and what role that they can play in making that shift. And then also, if you have a particular policy solution that you're advocating for, effective frame can help lead people to support the right policies that address that issue. So how do we do this? The average research project, one like this, typically takes 18 months to 3 years. So when working with the network and the DinaQuest Foundation, we overall engaged over 12,000 Americans and looked at hundreds of pieces of media coverage and advocacy materials. The goal with this project was not only to find out what the public thinks about oral health, but also to see what the connection is to overall health, and then to help the public understand how oral health is a social justice issue. And so from that work, we developed 3 framing recommendations that we've been working on the last couple of years. If you've ever seen a FrameWorks webinar or presentation or have gone to a convening, you probably are familiar with these. So the result of that research was a value of targeted justice, the value of responsible management, and the keys to oral health metaphor. These recommendations are based on a 2017 research report called Unlocking the Door to New Thinking, Frames for Advancing Oral Health Reform. These frame elements will be discussed in part 2 of the webinar series, Framing for Health Equity, Putting What We Know into Practice. So today I won't spend much time on them, but you can look forward to learning more and also how to apply them in that upcoming webinar. So for today's purposes, I want to talk to you about what exactly are cultural models. So we know that we understand culture in a myriad of ways, from music, food, clothing, dialect, customs, and more. But when you think about culture as a way to build a shared understanding of the world, one that crosses region, religion, race, gender, some of those other identities, frameworks turn to a theory in psychological anthropology. A lot of our work relies heavily upon the scholar Brad Shore, who has a definition of thinking of culture as an extensive and heterogeneous collection of models, models that exist both as public artifacts in the world and also as cognitive constructs in the mind of members of a community. So when we talk about culture and cultural models, it's a way to really break down understanding, not so much about what people say they believe, which is something that you might find in polling, but really what people leave unsaid. Like we're looking at what's underlying their thinking, informing what we do say. So you'll see here that simply cultural models are presupposed, taken for granted models of the world that are widely shared by members of society, and they play an enormous role in their understanding of that world. So what does that actually mean? Cultural models are really just how we make sense of the world. They're mental shortcuts or assumptions we make based on experience, our communities, social networks, the narratives that we hear in media, our neighbors, just sort of like all the information that we gather over a period of time that inform our thinking. This process that our brain goes through is sort of like sifting through mental data to not only determine what we know about an issue, but also how we assess what's important about that issue and whether or not we should act upon it. This sort of mental shortcut that your mind takes allows you to move forward in your thinking. These models are unique in that they are widely shared, and in our research process, what we're looking for, what is that cultural content that's shared across the population? So oftentimes we will get questions about how do people based upon race or gender really have the shared understanding of the world, and that's what cultural models enables us to do. So how do we actually identify cultural models? We go through a series of research processes, including one-on-one interviews that tend to be about 2 hours long. The questions that we ask are often open-ended. What we're looking for is to just really see how people talk about a particular issue and what are sort of the conclusions that they arrive upon. We oftentimes will identify 3 distinct locations and tend to have about 20 or so interviews. And while that may seem like a small sample size is what you're looking for, often you will find that once you talk to a few folks, you'll see that some common themes. And that again is what cultural models enables us to do, is see that even though we might be from different regions or parts of the country, that there is a shared sense that we have as a nation, and that has all sort of informed our thinking. That can lead us to sort of uncover that when we're talking about oral health or any other particular social issue, that we have some similar ways of engaging and looking at that particular issue. So when we're doing this work, we're looking at not just simply what does someone think about the issue, but if you're talking about oral health or access to care, we want to identify who people attribute responsibility to, what the solutions are that they think they might be, what are some of the outcomes, where does agency lie, what are some of the problems, and even how do people define that particular issue. So what does this all mean exactly? Oftentimes, as advocates and communicators, we are living, eating, sleeping, and breathing a particular issue, and we may assume that the public's mind is an empty vessel just waiting to receive our message and our charge as intended. But rather, thanks to various cultural models, including ones that compete against one another, the mind is actually more like a swamp. And so oftentimes people will ask us as it relates to the swamp if it has anything to do with our current politics. No, it does not. We've been talking about the swamp for about 20 years or so. So, sort of like an actual swamp, you will find positive, productive cultural models of thinking that can really be used to your advantage as a communicator. And then, of course, there's some that may eat up your message and hinder advancement of the solutions that you're seeking to gain support for. So with any research project, we first start by identifying those cultural models because we want advocates to see this as having a strategic advantage to their communications, that once you know how the public is already thinking about an issue, you may find that there are things that you're saying that you shouldn't actually be saying, and maybe finding new ways to talk about this issue that actually advance people to support your cause and have a better sense of the work that you're trying to do. So for each social issue that we work on, there is a swamp, but for today's purposes, I put together one swamp to sort of get at what we mean by oral health as it relates to health equity. So whether you are talking to legislators, parents, or the general public, there are multiple levels that you as a communicator have to wade through when you're talking about health equity. You're not just talking about getting people to better understand oral health, but you're also asking them to muddle through their understanding of race and class. If you're looking to address disparities, you're also asking them to think through immigration and immigrants if you're talking about an issue like public charge. And then you're also actually talking about the government and human services when you're looking at expansion or prevention and other supportive services. So there are a number of swamps that you have to wade through when you are talking about health equity. So, what exactly is in the swamp of oral health and health equity? You will find that people tend to think of health overall as individual choices that we make, that we are all responsible for what we do to our bodies, that has nothing to do with systems. If someone thinks about a system, it's difficult for them to really know what that system entails. Our research found that when asked about the oral health system, people tend to limit it to a dentist's office, where your team or dentists, hygienists, and receptionists. So that leaves very little room for you to talk about community support or having sort of a mobile office, or even being able to talk about if English is a second language, because people tend to not think of the oral health system as much broader in the way that you as advocates are. Also, when we're talking about solutions, advocates tend, or I'm sorry, the public tends to think of it as three simple things. You just brush and floss, go to the dentist, and that's it. Also, unsurprisingly, oral health is not a high priority among most members of the public. So, therefore, if you are trying to get people to better understand this issue, to put it on their radar, you have the challenge of making them cared in the first place. And then also, you'll find as it relates to solutions, when people do learn about this particular issue, there is a particular mindset that says there's nothing that society can do. That is what we call fatalism. Also, when we're talking about causes of problems, people aren't thinking about who has resources to what, but really seeing it again as individual choices that some people have poor hygiene or it's the parents' fault if their children have cavities. And then also, sort of as it relates to race and equity, there's the assumption that certain cultures just have poor self care, that is something that their culture simply does not care about. As it relates to immigration, and again, if you're talking about immigrant communities, and that can be anywhere from wanting to expand coverage to wanting to create materials that are in another language, the way members of the public tend to think about immigration is that it's zero sum. That I'm sure we've all heard people say that something like they're taking jobs or it's a drain on the system, it's a drain on resources. Oftentimes, because we sort of, as Americans, go between a nation of immigrants to a nation of law and order. One way that people tend to look at immigrant communities as lawbreakers and takers and immigration nostalgia, meaning that back when people followed the law, quote unquote. And of course, you will also see fatalism when talking about immigration as well. So again, the system is broken, that there are people who are crossing our borders, again, creating the sense of us versus them, that our nation is under attack and under threat. And when people have that mindset, it's really difficult for them to see any sort of like collective responsibility or a collective sort of action that we can take to support all people who are in the country. And then also, when you're talking about health equity and whether you're looking at government support or even your job in the public sector, people often don't understand what we mean by well being. And so, again, thinking of it as an individual responsibility, that there's no sense of systems, that really anyone who is facing poor health or is in need of support, whether that is any type of social service you can imagine, that's considered to have a lack of willpower, again, blaming on the parents. Again, there are just certain communities that are dangerous. They don't value health, they don't value well being. So it's not the government's job to help in any sort of way. And then again, when you're thinking about how you might improve well being, people have a limited way of understanding that. And so they think about the government as inept and corrupt, and so they're not thinking about the ways in which the government could actually support people's well-being. And then they also think that to get support that you should be looking at informal networks. So again, it's not on social services or even the nonprofit sector, but really it should be within your community and family members to take that on. And so, what does this actually look like when you're talking to members of the public? And you may recall from that earlier slide that we, as part of our cultural models work, we do on the street interviews.
It's just poor values. Why are people 300 pounds?
Okay.
Because they eat stuff they shouldn't, they don't exercise.
Right.
And they don't look after themselves.
A person that eats obviously a lot of candies like sweets and don't brush their teeth behind it, you can get tons of cavities.
There's people that, you know what, I'll do it tomorrow.
I mean, you have to take care of your teeth, you have to take care of your mouth.
I mean, you're in charge of it for if you have children.
Under 18, the parents are responsible.
So hopefully the sound came through for you all, but you likely heard someone say the poor values, that it's parents' responsibility if you're under 18. So without knowing anything about the particular issue that you're working on or the solutions that you are providing as an advocate or a communications person, we've found in our research that that is the way that the public tends to think about these issues. So before you can talk about a specific policy, you have to keep in mind that this is sort of the communications landscape that you are walking into. And here's one on human services.
Why do you think that some people have more difficult lives than others?
Some people make their lives more difficult by the decisions that they make.
Individual choices.
The amount of work that you put in, I think.
Effort, motivation.
Some people, I think, make their own trouble.
People don't understand mostly is that what you do now affects later.
Wherever you end up, wherever you are at the time is a result of how much work that you invest.
They should also try and help themselves too. I think they shouldn't try and play the victim card.
Everybody has the option to change their destiny, and you have the power to have it better.
People have to help themselves.
A lot of it has to do with the situation of their parents, I would say. Who you know, how much money you have.
A lot of it's about money.
Low wages. Sometimes when you've lived in debilitating environments, you don't have a hope for support. And so you don't go after it.
You heard the phrase human services?
No.
Human services?
No, I never heard of it.
Is that a general term? Yeah, I'm not entirely sure.
Human services?
Yeah.
We all serve each other.
The phrase human services pertains to people helping people.
Handing out food, clothes, different things.
Well, I do know they have the food.
They're always giving away food and supporting people in that way, I think.
For people who are not doing really well, like they don't have a place to live.
Very kind people.
People who are offering a service, giving of their time, giving of their finances, giving of their experience, and giving of their resource to help another person.
Lending that helping hand, making them know that there is somebody there that can help them.
There are people out there that are less fortunate than myself.
Charity organizations to help those that can't.
Giving back to the community, starting organizations that help people that may not have the means otherwise.
Healthcare for the homeless or just the food kitchens.
They're in a tough time, maybe money to help them get over whatever it is that they're trying to get through.
For those who can't do for themselves or having problems or difficulty, it helps them.
Hopefully that was a little better, but basically, for those who couldn't hear, they're saying things like everyone's responsible and in charge of their own destiny. Everyone has options, like everyone has access to the same sort of things. We know as advocates that that's not true. So again, as you're working on talking about disparities that different communities may face, keeping in mind that this is sort of a general assumption that members of the public have about this being the land of opportunity. So anything that is there is available to all of us. And then also as it relates to health equity, it's important to note the models that are around race as well as government. So when we're talking about anything related to race, people like what you saw in the immigration swamp, is people tend to operate with a sort of zero-sum thinking that if someone is to gain something, that must mean that I am going to lose something. There's also the matter of historical progress, meaning that the issues that we saw in the 50s and 60s or even before, like that no longer exists, that everyone has access to the same opportunity, that we are much further along than we once were. And while that may be true, that doesn't mean that disparities based on race and class no longer exist. Separate fates is a model that people have, and that we are just meant to live different lives, that Black people have their way of existing and living in the world, and that white people have their way of existing and living in the world. And there's no way possible for us to find shared value or benefits to living and working together. Something also unique with the race work is you will see this model of self-makingness. It's like individual responsibility, but slightly distinct in that, again, this idea that if you want it bad enough, you will work hard and get it. And then with well-being, and this comes out of our human services work as well, is that well-being is simply financial self-sufficiency. Well-being is not tied to health, it's not tied to education or transportation or housing. It's just simply having the means to get by. As it relates to government, government is tend to be thought of as just elected officials or the current administration, really politics as usual. If people don't think of government in that way, they tend to think of it as just sort of an everything else, that the government is just this inept bureaucracy where nothing gets done, that like there are no solutions that exist with government. People have a hard time seeing themselves as actors in a public life as it relates to the government, and rather that they are just passive spectators letting the powers that be in DC sort of rule and control everything. And then sort of to close out this piece, if you take nothing else away from this conversation today, there are three meta models that we have found across social issues, whether you are talking about education, immigration, climate change, public health, of course, oral health, is this individualism model, fatalism, and tribalism. So I've talked a lot about individualism and that, again, we are responsible for the choices that we make. Then there's no role for systems in there. There's no role for sort of implicit and explicit bias of institutions that for us to make it in the world, that we have to have the willpower and gumption essentially to get ahead. As it relates to fatalism, it's exactly what it sounds like, that the system is broken beyond repair, whether you're talking about the healthcare system, whether you're talking about government, whether you're talking about immigration, public education system, it's all doomed, that we just need to wipe it all clean and start over. And then with tribalism, just the idea that I have my team, you have your team, and that when I'm looking at social issues, I really have to see where my team sits with this. And tribalism is particularly important when you are talking about oral health policies, because a lot of times social goods are seen as one party over the other, but it's really not about partisan politics, but really what are sort of the systems that we need to put in place to make sure that everyone is able to live and thrive fully. But again, knowing that when you're talking about a particular issue and how you frame it, we have before talked about the matter of using a phrase like social justice. That's something that cues up sort of partisan politics in the way that that term is seen as a leftist term. So if you're talking about disparities and talking about equity, understanding like how can you talk about that in a way that shows that there is a shared responsibility, but also a collective benefit to us ensuring that we all thrive. And then just this last piece is sort of thinking about, these are things that you can do right now. The way that we look at cultural models is a sort of first step. Like it enables you to think about what you're doing currently in your communications and what you should stop doing. So if you never learn anything about how to use the values and metaphors, even though you will learn about them in a couple of weeks, is thinking about what you can stop doing currently and what you can start doing instead. So rather than telling stories about individuals, which I know is something that all communications folks who work in nonprofit have been taught to do, is really to think about how you can instead tell a story about the oral healthcare system. So you can still talk about people, but really highlighting how they move through a particular system to get the supports that they needed. When you're talking about certain populations or particular groups of people, again, think about focusing on the collective benefit and how if we collectively take action, that is a way to address inequity. When you're talking about government, rather than highlighting the fact that it is part of the problem and action needs to be taken, show that how the government is actually part of the solution, that we have different systems and processes in place that enable more people to thrive in this country. And so leading them to the policies that will actually uphold the promise of a democracy and a public good. And then rather than reinforcing the idea of individual responsibility, of parents needing to take certain actions and steps, instead explain and acknowledge failed policies that have been put into place or absent structures and systems that have created inequity. And if you would like to learn more, you can visit frameworksinstitute.org, and I believe this is also on the Socius website, but we have a communications toolkit, and then we also have the research report that all of this work is based upon. Then I think we have a couple minutes for questions.
Thanks so much, April. And I'm going to drop the link to the toolkit into the chat box. So for those of you that would like to unmute yourself to ask a question, everybody's currently muted, but if you're on the phone, you can press *4 to unmute. You can also press the microphone icon on the Blue Jeans window or type it into the chat box. So I see that there is a question right now. How can we explain the significant changes that occurred after the story of Diamante Driver? Is that an outlier?
Is that not what? What's the last phrase?
Is that an outlier?
No. So the way that you could explain that particular case is thinking about where systems failed. So you can use, when we say don't focus on an individual, we don't mean that you can't talk about an individual at all, but instead thinking about how you can situate that one particular story to talk about systems. So what made that situation happen? That it wasn't a matter of Diamante himself or his family, but thinking about which providers actually will accept Medicare. How easy is it to access a doctor? Where are they located? Things of that nature that stand as barriers to people actually accessing the care that they need, and then thinking about the solutions that need to occur so that doesn't happen again.
Okay, and can you please elaborate on how can we have a targeted advocacy and specifics for children's oral health as an issue of equity, social justice, and human rights?
What's the first part of the question?
If you could elaborate on how we can have a targeted advocacy. I think that's just with specifics on children's oral health as an issue. So if you're developing perhaps like advocacy materials or messaging, just to elaborate on children's oral health as an issue of equity, justice, social justice, and human rights.
Yeah, so I think if you are talking about children, like there are solutions available. So one of the sort of the formula that we tend to recommend is leading with an affirmative vision. So what is the world that we're trying to see? So like what sort of environment are you creating or wanting to create for children? Simply, why are you doing this work? And then that next piece of that formula is to speak to what's preventing that affirmative vision being seen or being realized, and then ending with a solution. So sort of stating the affirmative, showing why that isn't possible in the current moment, whether that is a particular policy or a particular restriction of a policy, lack of access, and then ending with like how we get to that solution. So how do you get to access to care? What does that look like for children? Is it talking about having mobile sites? Is it talking about having someone at the school, in your community centers? That's where you can sort of bring in what your solutions are at the end of that piece. And so if you're also talking about disparity specifically, you can speak to the unique ways that, say, for example, children of color or children in low-income families, what's preventing them from accessing care, and what are the resources available to shift that?
Okay, so how can we tactfully reframe oral health swamp messaging that oral health providers persistently convey? So I don't know if there was anything specific that Nancy was saying or just from the swamp that you had mentioned or had shown, but blaming the patient in particular, how can we tactfully reframe that messaging?
Yeah, so I mean, I think if you would imagine what are some of the factors that influence people's oral health care. So if you're talking about a particular patient, what's made them not, like whatever their sort of dental or oral health issue is, what are the conditions that made that so? So it's not to say that we can't talk about brushing and flossing, but what are some of the other factors? Is it a lack of knowledge or awareness? Like thinking about, again, moving it from the individual person and their actions, and what are the social factors that have made that so? And so again, like I think the case of communities where English is not the primary language, thinking about in that particular community, are the materials that are available to them, one, if the materials exist to educate and inform, but if they do exist, are they accessible? Thinking about it that way, that leads to sort of the outcomes that you might see once a patient or a person gets into the dental chair.
Okay, and an idea too is, can the policy on the age one visit be translated into an equity advocacy intervention? April, I don't know if you have any thoughts on that.
I don't know exactly what that is.
Okay, yeah. I want to. April is our linguist expert and framing and messaging, any mass media. So with growing knowledge of the oral health field, but I think that's a great idea that we can explore. And Francisco, we can connect offline to talk about maybe what that would mean and potentially get that into the policy network response team's agenda to be able to talk through. But I think that could be a great idea.
Yeah, and I think like just I don't know all the policies, of course, but I think when we're talking about equity, particularly if you are talking about racial equity, so also just being clear what type of equity that you're looking to achieve. So oftentimes I'll see in various nonprofit communications that disparity is really code for a particular racial group. And so when you're talking about race, and really honestly, if you're talking about equity, like it's important to highlight that we are, it sounds kind of hokey and after school special like, but it's backed up by research, that we are all in this together. So a way to help people understand equity is really seeing their role in changing the current conditions and dynamics. So thinking about how you might stay in a collective action frame so that if we act together, these are sort of the environments that we can change together, that we have a shared responsibility, but with shared responsibility also are shared benefits. And so really looking at your communications as a way to highlight what are the shared benefits. So one case might be if people don't have access to care and instead that they are visiting emergency rooms, what is sort of the drain that's putting on resources, all because we haven't taken the necessary steps that exist and are available by making sure that care is available to more people.
And it looks like one final question, unless we have any more, but and this could be a great plug for a few things that we have, but does FrameWorks provide in-person trainings on this content?
We most certainly do. So coming up, if not in person at the moment, the next set of things that we have, as you'll see on the screen, we have a webinar on December 18th, where my colleague Jessica Moyer will actually be walking you all through those frame elements that I mentioned before. And on that webinar, it'll be, I think it's an hour this time, and she'll actually give you some time to work through your communication. So if you want to be a part of that, is to come with maybe your own set of talking points, and you all will be able to work on reframing them on that webinar. We also will have a couple of other pieces that we'll be adding to Socius, some sort of like one-pagers that will really guide people through how to apply these recommendations to their communications. And I can't encourage enough to visit the toolkit that I believe Frances said she put a link into the chat box, because there are a lot of great resources in there, and we'll also be adding to it over the next several months that include like real-time communications pieces, whether you're talking about web content or social media, and it actually walks you through and gives you guidance how to apply these recommendations and why they fit and work. And then also feel free to reach out to me, or Francis can connect us and we can think of other solutions if folks are looking for more hands-on support.
We also, as the communications and messaging work group on the National Oral Health Connection team, we know it as the NOCT. There is a request form for communications and messaging support. I'll include that along with the recording to today's presentation, but you can actually, if you're developing any materials or any messages or updating a website, anything that you're doing that could use communications and messaging support, there is a form that you can fill out, and one of the questions includes if this requires some technical assistance from FrameWorks to be able to really develop a message that could potentially be shared broadly by all network members. So that's something else that all network members have at their disposal. And so the communications and messaging group, they're also very well versed in these frames and could be able to help out. And then we've got April as our big guns to be able to help us think through some more technical pieces. So we have that. And then we also, as April mentioned, we can share out everything from the framing toolkit to different webinar presentations on Socius, and hopefully we'll see them back at our convenings this year as well.
Definitely. Well, I think that's it.
It looks like that's all the questions that we have. We have a lot of thank you, and even throughout the convening, we've had people saying that you always teach so well, and that there was a lot of compliments to your voice. So.
Oh, thank you. I used to be in radio.
Awesome. Okay, well, thank you everybody for joining us, and we'll have this recording out as soon as it's ready. And thank you so much, April.
Awesome. Thank you all.